Hi everyone, my name is Adrian Carvalho.
Dr. David Atwood.
And we're with Marin Peak Physio. And we're here to teach you guys how to do a proper plank for healthy backs.
Harder than you might think.
My patient here, we're gonna go over a plank and one of the probably most popular exercises for back health, right? So first thing I like to do is make sure that the elbows are directly under the shoulders to make sure that we don't have any extra pressure on the shoulders. Second thing is we're going to make sure the feet are about shoulder width, if not a little bit closer together. And before I have David go up, I'm actually going to have him squeeze his glutes because the booty is part of the core. All right, and then we're going to pull the abs in and we're going to come up, keeping those glutes squeezed. Good, good. And I'm basically making sure that his abs are staying engaged, make sure he's breathing. There's no big sway in his back. That looks perfect. Excellent. All right, some common mistakes that I see with planks. I always love when patients come in and I say, oh yeah, I can hold a 5-minute plank. And so one of the things we don't want to do is just rest on our joints and our ligaments. So if David comes up into a plank and there's just this big arch and he's just hanging out there, then he's not really working his abs or his glutes. He's just kind of putting some compression in his spine. So how we want to correct this is just pull this up and in. Good, booty squeezed. Excellent. Perfect. Another common mistake with a plank is that sometimes people will actually think a plank is supposed to be a board. We don't want to be up in a V. So for example, if David comes up and I see his booty sticking up straight to the ceiling, that's definitely not a plank. We want to bring his butt back down, making sure it's squeezed. His lower back is nice and level. Excellent. Thanks so much for watching. If you liked that video and more, make sure you hit that subscribe button and leave a comment, and we'll have many more to come.